Well, a gigantic study by the CDC, the most important study that has been done, that looked at masks and looked at opening restaurants and the dangers of that. The CDC is now touting the biggest study they have ever done. And this is what that sounded like in the news.
Scientists at the CDC say they now have evidence that masks work.
Masks work.
Masks work. Mask mandates work. And lifting mask mandates is very dangerous.
Mask mandates reduce COVID-19 case counts and deaths, according to more data published today by the CDC.
A sobering new study from the CDC, which looked at counties that allowed indoor dining and those with mask mandates. It found that those with restrictions had far lower rates of illness and death.
With the optimism of reopening comes the warning of a flood of new infections.
We have seen this movie before. When prevention measures like mask mandates are rolled back, cases go up.
It's critical that they follow the science.
Well, the news went crazy about this study. Of course, this has been a debate. This is what I've been blamed for spreading misinformation here by sharing studies from around the world that show that vaxxers are essentially, that masks are essentially useless. I've also pointed out the fact that originally Tony Fauci was against masks, and then he decided, no, you have to wear a mask, and just recently switched to 2 masks, which I think proves that 1 mask must not have been working very well. But the media went crazy because they finally had their study, okay? Now, today we're going to be talking about a lot of things, but I want to talk about truth. I want to talk about the discussion of truth. I want to talk about inflating the truth or maybe misrepresenting the truth. How badly has this story been misrepresented? I'm going to start out with a question for you. Given the headlines that you saw, let's read a couple of these. Here we go. CNBC. CDC study finds easing mask and restaurant rules led to more COVID cases and deaths as some states moved to lift restrictions. CNN Health says mask mandates and restaurant restrictions tied to fewer COVID-19 illnesses and deaths. CDC study says we've now got our proof. And here's another one. Study finds mask mandates and dining out influence virus spread. They've got their proof, right? It's everywhere. It's headlines across our nation. Now, I'm going to ask you, when you hear those headlines and you hear affirmatively they're saying, you better not open up or there will be a wave of cases, right? In your mind, let's think about this study. Let's bring up this question. I want you to guess the rate of COVID decrease they discovered with mask wearing. Now, this study basically looked at before we had mask mandates and after in all of the counties. I mean, they spent millions of dollars on this study, so this is going to be as accurate as you can get. Did masks reduce the growth rate of the spread of COVID by 90%? By B, 50%? By C, 20%? And as you look at that, I want to ask yourself, what percentage would you want to see the, decrease of the growth or the spread of COVID-19 in the cases? What percentage would warrant all that's happened with masks? Okay, now that you've asked that question, why don't we go to the science for an answer? So for the answer, let's go to the study itself. Now, this is obviously, let's bring it back here. I want to be honest with people. Remember, I worked for CBS, okay? I won an Emmy Award producing the CBS talk show, The Doctors. So I understand the news. I understand how this works. And what I'm going to show you is that journalists are failing you. Here's what they looked at probably. Let's look at the headline first. Association of state-issued mask mandates and allowing on-premises restaurant dining with county-level COVID-19 case and death growth rates. United States, March 1st to December 31st, 2020. Sounds huge, right? It's gigantic. I mean, county by county. And believe me, this was a huge study. Now, just like when you're doing a book report in elementary school and you didn't actually read the book, you got to ask yourself, could I write a whole book report just on that headline? It would be tough. But you see, the CDC does you a little favor. They give you the cliff note right at the top. So let's check out the cliff note that the CDC provided to all the journalists that don't want to read the whole study. Here we go. Here's the summary. Mask mandates were associated with decreases in daily COVID-19 case and death growth rates from 1 to 20 days, 21 to 40 days, 41 to 60 days, 61 to 80 days, and 81 to 100 days. Yes, we looked at all of those categories and days after implementation, allowing any on-premises dining at restaurants was associated with increases in daily COVID-19 case growth rates on 41 to 60 days, 61 to 80 days, and 81 to 100 days after reopening. And increases in daily mandates was associated, now we're talking about masks, with reduced SARS-CoV-2 transmission, whereas reopening restaurants for on-premises dining was associated with increased transmission. There you go. Now you got your cliff note, now you can really fake a book report, or maybe even a CNN headline news story. What you're going to say is, CDC study shows that wearing masks had significant decreases in the spread of coronavirus, and opening restaurants was seen with an incredible increase, a wave of cases, right? That's how it's reported. And that's what you had right there. They said it right in the summary. Moving on. Only one thing that we do a little bit different here at the High Wire than apparently everybody else in the world of media. We actually read the whole study, okay? Including the charts even, okay? So why don't we go to the chart on this, shall we? Here's the chart that we're actually talking about. Association between state-issued mask mandates and changes in COVID-19 case and death growth rates. United States, March 1st to 20. This is what they did. Remember all those categories. So what they did was they looked at the days before they had the mandate. So 41 to 60 days before, you were at about a 0. At 21 to 40 days before, it looked like masks, that not wearing masks, we were seeing a growth rate of, was going up faster than before. But the reverent, 1 to 20 days before, this is the reference point that they do the rest of the study. The rest of the days will be referencing where were we at days 1 through 20. So here we go. So you ready for it? Was it 90%? Was it 50%? Was it 20%? Well, in the category of 1 to 20, the first days of the mask mandate, let's bring up this graph. There it is. 1 to 20 days after, we had an incredible 0.5% reduction in the growth rates of cases and a 0.7% reduction in deaths. Now, first of all, you got to ask yourself, how did you see a drop in deaths 20 days in? The virus would have to run its course first, so that even seems like a fake number. But either way, did you recognize that 0.5 percentage point was the gain made by masking? That was what was this incredible decrease? Let's look at the rest of the days, because it gets better. It gets better. By 21 to 40 days, we rose to an incredible just over 1% gain on the spread of the illness. And by 41 to 60 days, an astonishing 1.5% reduction in the growth rate of COVID-19 across the country that really took fire by days 61 to 80 when we made it to a full whopping 1.7% drop in the growth rate of cases. And then, of course, the coup de grace, 81 to 100 days, we made it to an incredible 1.8% drop in the growth rate of the illness and the cases across America. All right, folks, when we look at this, I know people are saying we get confused. So I want to try and make this as clear as possible. Can we get a pie chart, please? Now imagine there's a pie chart, and we're thinking about, remember, in a pie for 100%, if we're going to have 90% success rate, meaning we reduce the spread of coronavirus by 90% by wearing masks, you would see 90 pieces, right? So here's our pie, and there's where we're at. That was it. That was the greatest amount of decrease we saw in all of the masking of the entire United States of America. Every county where we did it, that many people, 98 people out of 100, were having no effect whatsoever. We were only seeing a mitigation of growth of 1.8%, not even 2%. We destroyed the lives of our children in school. We destroyed restaurants and everything else, and we made everybody wear masks. We robbed you of free chances to breathe the air because we were getting a whopping 1.8% return on our investment of perpetual mask wearing. Okay. Now, maybe that seems big to you. Hopefully, you have enough brain cells and you are saying, what? What? Now let's look at restaurants. Restaurants opening. How many restaurants in your neighborhood say out of business? I just heard on the news today, they were saying in New York City, it feels like every other door is a closed business. How many businesses were shut down because they had to lock down? We couldn't have the spread, especially in those, those petri dishes of disease known as bars and restaurants. What happened in the states where we actually saw them defy the restrictions and open up? What we saw, if we were going by CNN and the news, was a wave of cases that set us back. As Joe Biden put it, we can't allow that to happen. So let's ask the question again. When you hear about a wave, when you hear the President of the United States saying it would be absolutely catastrophic if restaurants were to open in Texas, what do they actually mean? Can we have the question? Guess the rate of COVID increase from restaurants opening. Do you think it was 90%, A, B, 50%, C, 20%, or D, 2%, something like what we achieved with mask wearing? Or none of the above? Actually, as it turns out, it's none of the above. Shall we look at the numbers? Should we actually read deeper into the charts and the study and what it actually said? Let's take a look at the charts. Once again, they're looking at those first 40 to 60 days, 21 to 40 days to see where we were at. But then 1 to 20 days before is what we used as the baseline we were going to compare to. So comparing the 20 days after, the first 20 days, 20 days after opening up restaurants, we saw, we didn't see an increase. We saw a decrease in the amount of cases in those counties across the country. What? So for the first 20 days, when restaurants opened up, it went down 0.4%. Now, I would never celebrate that because that is a ridiculously small number, but let's be clear. It went down, not up. We didn't see cases increase. And then 21 to 40 days later, when restaurants and bars were wide open in these places, they were still at a decreased growth rate of 0.1%. Still nothing to scream about, but it wasn't making the matter worse. But then, all of a sudden, that tidal wave comes. That gigantic tidal wave comes, and then we see 41 to 60 days after, a whopping 0.9% increase in the growth rate of cases across America, almost 1%. And then it really gets out of control 61 to 80 days, where having all of our restaurants and our ability to eat out and to keep our economy steaming ahead, and they've got to shut that down. When we decide to open up, by 61 to 80 days, a whopping 1.2% growth rate was discovered. And then, once again, actually it didn't go up. By 81 to 100 days, it starts dropping down to a mere 1.1% growth rate of cases in America. Folks, everyone that owns a restaurant out there, the restaurants in California and those places that we've had the owners onto our show that are in courtrooms fighting because they resisted the mandate and said, no, I'm not going to destroy my family business because you're telling me I have to. I have a right to breathe air. My customers have a right to breathe air. And they have a right to come into my restaurant and have food and libations. And as it turns out, by resisting those orders and opening up, we only had a 1.2% increase in cases. That's it. There it is. That was the entire gain made by wearing masks and by shutting down. By shutting down restaurants, or in this case, opening up restaurants, this was the increase. Let's look at the two together, shall we? This is what it's all been about. Lock everybody down, keep them out of restaurants. We saw an increase of 1.2% when we went against that. Put everybody in masks, that was the amount of decrease we saw in the entire puzzle, an entire piece. Do you realize how many years, maybe decades, you would have to continue these measures to ever actually have an effect that mattered to any human being on this planet? The media is not telling you that. So either they are totally misrepresenting it, or as I would guess, they are so freaking stupid they don't know how to read an entire study put out by the CDC. And the CDC knows that, don't they? Do you think they don't know that the reason that they're writing a summary that doesn't have any of the numbers, it doesn't tell you it's 0.1% or 0.9%? They leave all of that out so that you will run with your headline. And then if you actually read the study, you have to read about 2/3 of it before you get to the part where they actually start presenting numbers. You know what they're doing? It's as simple as putting lipstick on a pig. There it is. This is the great report of the week. Masks work and restaurants should be shut down. Baby, that is a pig if there ever was a pig. And no matter how much lipstick you put on it, the American people will not put up with results in the 1% to 2% range. And then when you think about it, think about if that's where masks are at and they're lying about masks and making it sound like that really had some great effect. What do we think about vaccines? It makes me reflect on what the former head of the CDC said about masks compared to vaccines. Take a look at this.
These face masks are the most important, powerful public health tool we have. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will.
There you have it. I mean, if that face mask is even better than the vaccine at its whopping 2% of mitigation possibilities, maybe you really got to start asking yourself, what the hell is in this vaccine? Does it do anything at all? And remember, when we're talking 1% to 2% in giant population studies, obviously they can't account for age and all the comorbidities and, what was actually going on, what was the weather. None of that is in there. So at 1.2%, you might as well just blow it off the table. It's a sand painting. There's nothing there. And that is the best study they ever did. If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, YouTube, iTunes, and Twitter. We'll see you there.